The city lights always seemed to flicker a little dimmer when I was on a case like this one. They called him the surgeon, a name whispered first in the squad room, then screamed in the headlines. It began with a call to a high-end apartment, the kind with views that stretched for miles. But inside, the view was pure horror. The victim was on his bed, still alive, but barely. A gaping, impossibly precise wound was carved into his side. His kidney was gone. The first responders were speechless. I'd seen a lot in my 20 years on the force, but this was different. The precision, the audacity. It was inhuman. The victim couldn't tell us anything before he slipped away in the ambulance. All we had was a scene that was chillingly clean. No forced entry, no struggle, just a missing organ and a man left to die. We were baffled. Forensics found almost nothing. A trace anesthetic in the victim's system, the kind used in operating rooms. The incision was made with a surgical-grade scalpel. This wasn't a back-alley mugging gone wrong. This was a planned, executed procedure. As we canvassed the building, a neighbor mentioned seeing a man in medical scrubs leaving around the time of the attack. They assumed he was a private physician, not uncommon in a building like this, but the description was generic: average height, average build, face covered by a surgical mask. He was a ghost. Days turned into a week and the city held its breath. Then the second call came. Different part of the city, same terrifying signature. This time, a young woman. And this time, it was a piece of her liver. She survived, just barely, but her memory was a fog of disorientation and a sharp clinical pain. She remembered a calm voice telling her to just relax. The media storm was a hurricane. The surgeon was on every front page. Public panic was through the roof. My captain was breathing down my neck. The mayor's office was calling every hour. We felt like we were chasing a phantom, always one step behind. I spent my nights staring at the case files. The images of the wounds burned into my mind. Who had this kind of skill, this level of arrogance? We started cross-referencing every surgeon, every medical student, every disgraced doctor in a 100-mile radius. The list was thousands of names long. It was like trying to find a single needle in a continent-sized haystack. The pressure was immense. Every new lead turned into a dead end. We were drowning in data, but starving for a clue. Then we got our first real break, from the place I least expected it. The second victim, the young woman, began to have flashbacks under hypnosis. She remembered a smell, not the antiseptic smell you'd expect, but something else. Old books. And a sound, a faint rhythmic ticking like an old grandfather clock. It wasn't much, but it was something human, something out of place in a sterile operating environment. Old books and a ticking clock. I started thinking outside the box. This wasn't just about medical skill, this was about something else. The victims didn't seem connected. One was a wealthy businessman, the other a struggling artist. What did they have in common? I went back to the first victim's apartment, searching for anything we might have missed, and there, tucked away in a drawer, I found it, a receipt from a rare book auction dated a month before the attack. He had purchased a 19th-century medical text. My heart started pounding. I immediately checked the second victim's background, and there it was. She had recently worked as a temporary archivist at a university library, cataloging a collection of antique medical journals. This was it. This was the link. The surgeon wasn't targeting people for their organs. He was targeting them for their proximity to rare medical literature. He was a collector, but not of books. He was reenacting the procedures he was reading about. He was a historian of the grotesque, and our victims were his canvas. The ticking clock, the smell of old books. It all started to make sense. He was likely operating out of a place that housed these things. A private library, a study, a place where he felt comfortable. We narrowed our search from thousands of medical professionals to a much smaller, more specific group. Individuals with both medical knowledge and a documented passion for antique medical books. The list was now manageable. Dozens, not thousands. We started digging into each one, looking for anyone who fit the profile. And then we found him, Dr. Alistair Finch, a brilliant but disgraced surgeon who had lost his license years ago due to an ethics violation. He had a god complex and a temper, but more importantly, Public records showed he was one of the world's foremost collectors of pre-anesthesia surgical texts. His address was a secluded mansion on the outskirts of the city, a place known for its vast private library. We had our man, but we needed proof. A warrant was secured, and we prepared for a tactical entry. We had to assume he was armed, dangerous, and would not be taken easily. The drive to the mansion was the longest of my life. Every tick of my watch sounded like the clock the victim had described. As my team stormed the mansion, I went straight for the library. The smell of old paper and leather hit me like a wall. In the corner, a massive grandfather clock ticked away, each swing of its pendulum marking the seconds of a twisted obsession. And there he was, Alistair Finch. He was standing over a refrigerated medical container, wearing scrubs, a scalpel in his hand. He looked up, not with panic but with annoyance, as if we had interrupted a sacred ritual. He didn't fight. He just smiled. A cold, chilling smile. "You're too late, Detective," he said, his voice calm. "This specimen is already preserved." He believed what he was doing was art, a tribute to the pioneers of surgery. In his mind, he wasn't a killer, he was a curator. The organs we found, perfectly preserved and catalogued in his basement lab, were his collection. The trial was a media circus, but the evidence was overwhelming. Finch's private journals detailed his work, his twisted admiration for the brutal history of medicine. He saw his victims not as people, but as contributions to his gallery of flesh. He showed no remorse, not a flicker of it. For him, the sanctity of his collection was far more important than the lives he destroyed. Locking him away was a victory, but a hollow one. The scars he left on the city, on the survivors, on me, they don't fade. Sometimes when it's quiet, I can still hear that clock ticking. It's a reminder that the most terrifying monsters aren't the ones who hide in the shadows, but the ones who walk among us, convinced they are heroes. This case taught me that evil doesn't always wear a monstrous face. Sometimes it wears surgical scrubs and quotes from antique books. It's a quiet, intellectual kind of horror that burrows deep into your soul and stays there. Hunting. The surgeon changed me. It solidified a grim truth I'd always known. The line between genius and madness is as thin and as sharp as a scalpel's edge, and sometimes you have to cross it to catch the monsters. Thank you for joining me on this journey into one of my most haunting cases. The world is full of mysteries, and not all of them have neat endings. If you find these stories as compelling as I do, make sure to subscribe and hit that notification bell. There are many more files to open. Stay safe out there.